So what comes to mind when I ask, what is a sexual dysfunction? If you're like most of the people I've talked to, you might have these vague ideas developed from those late-night infomercials, the ones promising improvement to that certain part of the male body, or adverts for pills that suggest they'll improve moonlight walks with your younger wife. You can read between the lines on that one. These advertisements are trying to sell a product to treat the disorder known as erectile dysfunction, which is the most commonly recognized sexual dysfunction thanks in part to the media saturation of such ads. In reality, though, it is but one of a multitude of sexual disorders, many of which can affect men or women, and are much more common as well.
On average, 10% of men will suffer from erectile dysfunction. In America alone, that's 15 million men. 25 to 40% of men will suffer from a condition known as premature ejaculation. 21% of 18 to 29-year-old women will complain of pain during intercourse. 16% of them, sexual anxiety. As many as 20% of women will experience a condition known as hypoactive sexual desire disorder. All told, 40% of women and 30% of men will suffer from some form of sexual dysfunction in their lives, a condition defined by the American Psychiatric Association as difficulty experienced by an individual or couple during any stage of normal sexual activity, including desire, arousal, or orgasm.
But why should we be concerned about these statistics? And if these problems are so common, why haven't we heard more about them? To answer these questions, and to better understand sexual dysfunctions and what role psychology has in treating them, we need to first look at two things: the history of sex research in the medical and psychiatric communities, and the benefits of sex on our overall health. Sex has always been a driving force in human culture. It has had more influence on the art, music, and literature of every civilization than anything else, more so than war, more so than religion. But for all of our fascination with the act, our scientific understanding of sex has been, well, less than stellar. When famous anatomical artist Leonardo da Vinci set out to depict the anatomy of two people engaged in intercourse, he illustrated the womb as being connected to the breast by a tube, reflecting the medieval belief that menstrual blood was converted into breast milk when a woman became pregnant. Sigmund Freud, father of modern psychology, believed women who experienced clitoral orgasms were infantile, that it was a stage they were supposed to grow out of. Even into the early 20th century, doctors were treating women for a condition known as female hysteria, the symptoms of which supposedly included faintness, nervousness, and insomnia. Fortunately for these women, the condition was treatable through vigorous pelvic massage till the patient experienced what was called hysterical paroxysm. In fact, some of the earliest electrical appliances available to the public were vibrators specifically marketed to treat this disorder. Ironically enough, they were often sold in catalogs that featured grisly anti-masturbation devices for boys, as the belief was still prevalent that masturbation would make you blind, bald, ugly, and insane. But the reason why men got bear traps in their pants, while women benefited from the invention of the vibrator, was because doctors at this time still didn't understand female sexuality. It wasn't until much later that doctors and psychiatrists even came to realize that women experienced orgasms just like men. Over the past 75 years, though, scientists have been working diligently to expand our understanding of human sexuality. Thanks to the efforts of researchers such as Alfred Kinsey, William Masters, and Virginia Johnson, we now know that masturbation will not lead to insanity or blindness. But instead, it has been proven to significantly reduce both stress and the risk of prostate cancer. And it's not just self-love that can make you healthier. Researchers have identified a number of health benefits that come from a healthy sex life. Sex can greatly improve cardiovascular health in men. One study showed men who had sex twice a week were 50% less likely to have fatal heart attacks as those who only had it once a month. Another benefit is an improved immune system. Having sex once or twice weekly has been linked with higher levels of an antibody called immunoglobulin A, which can protect against getting colds and other infections. There's even evidence that sex can improve your sense of smell, as the hormone prolactin, which is released following orgasm, stimulates the brain to develop new neurons in its olfactory bulb. But by far, the most health benefits that come from sex are due to a hormone called oxytocin. Oxytocin is a veritable wonder drug, responsible for a wide array of health benefits in humans. Sometimes called the love hormone, oxytocin aids in feelings of bonding and intimacy. Also present in large quantities at childbirth, it is responsible for the gushy, heartwarming, unconditional affection aspects of love. Oxytocin also relieves pain. Immediately before orgasm, oxytocin surges up to 5 times its normal level, increasing the production of endorphins at the same time. These endorphins can alleviate pain from migraines to arthritis, and in combination with the estrogen released during sex, will also relieve the pain of PMS in women. The combination of the oxytocin and prolactin hormones can also improve sleep quality, which carries with it a wide array of health benefits all on its own. This cocktail of hormones is why men frequently feel sleepy after sex. Sex is such a fascinating function in people because of how our various biological systems interact. In our minds, we can have arousing thoughts or fantasies, and our fun bits will respond. Vice versa, our reproductive system can release hormones that alter our behavior or feelings. Caught in the middle of all of this is the rest of the body, which generally sits back and reaps the benefits of this hormonal back and forth. But what happens if something goes awry in any one of these three systems? The result can have a much more serious impact on our health than just ruining our love life. Our mental health, our sexual health, and our physical well-being are all intertwined. What this means is that a sexual dysfunction, like for example impotence, can cause depression, followed by a suppressed immune system. A psychological issue, such as sexual anxiety, can lead to impotence or high blood pressure. Finally, a physiological issue, such as poor coronary health, can lead to impotence followed by sexual anxiety. Because of how intertwined our brains, bodies, and sex organs are, many sexual dysfunctions can be either a cause or an effect of other problems. To make matters worse, it is possible to get caught in an ever-escalating cycle with some of these disorders.